We know GLP-1s have been increasingly popular lately, but now there's a new study that compares Wegovy and Zepbound, and the results are really surprising. So joining me now is Dr. Sonal Haerter with Dignity Health Medical Group. She's also a board-certified obesity medicine specialist. Tell me about this new study.
Okay, so this study was the first head-to-head trial between Wegovy and Zepbound. We know both medications are FDA approved for weight loss.
Right.
But what this study showed was they had 800 participants with obesity or overweight and complications, but no diabetes. So these people were given either Wegovy or Zepbound, and they were given a maximum dose or maximum dose tolerated by the participant for about 72 weeks. And at the end of 72 weeks, what they noticed was, or what they found was, Zepbound resulted in about 50-pound weight loss compared to 33-pound weight loss in the Wegovy group. Not only that, Tram, it was also waist circumference, 7 inches waist circumference reduction in the Zepbound population versus about 5 inches in the Wegovy population. Now, they both resulted in weight loss, but you can see significant.
That's a big difference.
Yeah,
over 10
Also,
pounds.
women had more favorable outcomes in this study compared to men when it came to weight loss, as well as I think overall the side effect profile with Zepbound was lesser than Wegovy.
Well, I mean, obviously common sense, it sounds like Zepbound is more of a winner than Wegovy. I mean, you know, not to discredit Wegovy in any way, but what about, let's just say, the people who are taking Wegovy? I mean, should they have second thoughts about switching, or what do you think?
If they're actually tolerating this medication and they are attaining their weight loss goals as medically recommended, there's no reason to switch to Zepbound at this point.
Okay.
But clearly, if you have a choice, and you know, Zepbound would be a winner based on the study.
Right, right. Okay, so this is interesting. There's also some kind of an effect of semaglutide on fatty liver disease. Explain that.
Correct, and that's actually Wegovy. Wegovy is semaglutide. Also, semaglutide is Ozempic. Now, there was a new study that was also published that showed significant improvement in fatty liver. Now, why do we care about fatty liver? 1 in 20 adults actually has fatty liver, has no symptoms, often associated with obesity and being overweight. But what happens with fatty liver is over time you can get chronic inflammation leading to scarring and sometimes liver failure. Also increases your risk for liver cancer. So what this study actually showed was semaglutide reduced the inflammation. About 2/3 of the participants who were on Wegovy or, you know, semaglutide had reduction in their inflammation. About 1/3 had reduction in scarring, and 1/3 had reduction in inflammation and scarring. Now, this is significant because this disease can result in liver failure, sometimes liver cancer, and oftentimes these patients need liver transplant, and it's more common than you would think.
You know, it's so interesting with the different, you know, GLP-1s and kind of the benefits also with each and every one.
We do know that these medications have shown benefits in Alzheimer's, in dementia, in addiction, of course in diabetes and obesity, but so many other inflammatory conditions. And I think it goes down to it has widespread systemic anti-inflammatory effect, as well as it helps in reducing weight. And when we do lose weight, there are some, you know, great benefits.
So many ripple effects.
Absolutely.
Yeah. Excellent information.
Now, just real quick on the liver inflammation medication, that is FDA not approved yet. This was just a study result, and it's actually for a priority review by FDA. It's in the process. So hopefully we get that approved in about 6 months.
Very promising nonetheless. All right. Sonal, thank you so very much. Always interesting.